T-Bone and Heather in the morning on Star 98.3 and 97.7 The Bay.
Thank you, sir. We're going to jump in here this morning because we have Dr. Laurence Polsky on the line. Hi, good morning, doctor. How are you?
Good morning. I'm doing great. I hope the two of you are doing well.
We're top of the world, baby.
We are kind of obsessively taking our temperatures, Dr. Polsky. Like every morning we get up, we take it. We take it at lunchtime just to see where we are, and we've made it a competition, and high score wins. So I've been winning a lot lately. But still, what are we, like 98.7? What is a fever, Dr. Polsky? I mean, something that you should say, okay, you've got a fever. We need to take a look at your symptoms.
Well, I would think your normal would be 98.3.
Mm-hmm.
Yes,
right,
exactly.
And so what we get concerned with, so things go in Celsius in medical terms, and the cutoff they have then translates to Fahrenheit to 100.4. I would always tell my patients anything over 100 is something that potentially would be concerning.
Okay. Anything over 100. Gotcha.
Let's get the latest. First of all, tell us how things go on your end and what you're hearing, Doctor.
Well, certainly there's a lot of planning that's been going on, both within our health department and with all of our county partners. We've been meeting several times a week with the staff over at Calvert Hospital, but really all across the county, Department of Aging, Department of Social Services, everybody is taking a look at not only coronavirus, but also the essential services that we provide on a day-to-day basis. And we've been in touch certainly with our state partners and getting updates from the CDC as well.
Right.
Now, go ahead, T.
Well, I was just on that note. So overnight, there has been a big spike in the amount of people who have tested positive for the coronavirus, at least in the U.S. I see that as a positive thing because we're finding out the true numbers. I don't think you can deal with anything, any kind of bad situation, unless you know the real numbers. Is that accurate, or is this something we should be concerned about?
I would agree completely that the more information we have, the better we can deal with almost anything. But certainly, I'm sure, as you're aware and your listeners are aware, we're still far from where we need to be as far as testing capacity.
Yeah.
And how is the testing going in Calvert County? I know MedStar St. Mary's, they've set up like a drive-through if your doctor gives you, a script or a note to go get tested. Well, what's going on in Calvert County for that?
So all across the state, in every county, there are already plans as to how we will do this. The supplies are very limited, so they did have a little bit more stock on hand in St. Mary's than in most other counties, but they do not have unlimited testing kits there as well. And then on the other end of things is once you actually get the test, then the turnaround time at the labs have been at least 5 days, which makes things very, very difficult, both in terms of being able to advise people who have been tested, and of course, as from a treatment end, at that point, you're very limited as to what you can do.
Doctor, let me ask you, this is a very generic question. I don't mean to be putting you on the spot with this, but just for people's own kind of idea of what they're dealing with, let's say you are suffering from COVID-19 symptoms. You've got the chest thing happening, you're running a fever, it's all gross and yucky. Typically speaking, what is the length of sickness? How long are people sick?
Good question.
So I wish I could give you a precise, and so the best I can give you is a range.
Yeah.
And certainly this is going to depend, like when people get a run-of-the-mill cold or when they get the flu. Underlying conditions, whether they have asthma, other conditions are certainly going to shift this. So some people are completely asymptomatic, certainly meaning that they don't have any symptoms at all. For those who do develop symptoms, for some people it's very mild and maybe just lasts 3 or 4 days. And for other people, for people who are getting very sick, what we're seeing there is it's really into the second week before it gets to a point where things start to become life-threatening.
Okay.
Then it oftentimes goes into week 3 before we see for those people whether they're going to recover or whether they will end up dying from the infection.
Right.
And it really depends on the patient. Is that right, doctor? I mean, because you have the same scenario with the common cold, a cold that I could get I'm like miserable and achy, but a cold that somebody else gets, the same one, they're okay in a couple of days.
Yeah, the person is the deciding factor on there. I was just kind of looking for a range. If the average person gets this,
right.
Are they looking for are they looking at 2 weeks being down? Are they looking at a month being down? And it sounds to me, as if I'm getting the information correct from you, that if they're not going to progress to that stage where they need hospitalization, they're probably looking at about a week.
For people who were most concerned about as far as life-threatening complications, and as we've been talking about the last couple of weeks, those are people who were 60 and older and people who at any age have significant underlying health conditions, especially those that would compromise their immune system. It's really, we expect that they're going to be sick for more than a week, and it's that second week that's really going to be the best indicator whether they will ultimately recover or whether this will.
It's going to go south.
Hey, I have a couple of questions from some listeners. Do you feel like taking some questions?
That's fine. Go ahead.
Okay. One person called up yesterday, and there is a lot of misinformation out there, and I said it earlier. Everybody is an expert now on COVID-19. You ask anybody, they know exactly what's going on.
I'm basically a doctor now.
Exactly right. But one caller called up and said that she had heard that it was 3 times more contagious than the flu. How contagious is COVID-19?
And I wish I could give really specific answers to a lot of questions that people have. And as you may have seen, some of the answers and you may hear through what I say, that some things that I have said the last 2 weeks, I'm going to say different things now. So one of those things that's different is that previously the best research out there was showing initially that the virus would only last on surfaces for probably 4 hours or so.
And now?
Now, as you've seen over the last week, better research is showing that the virus will last on hard surfaces for at least a day and maybe as long as 3 days.
Wow.
And the previous recommendations were that when somebody was sick with the virus, that once their fever stopped and their symptoms started to subside, that after about 24 hours beyond that, it was very unlikely that they would transmit the virus to anyone else. The latest, which just came out, I think, 2 days ago from the CDC, is they're now recommending 3 days after fever stop and reduction in symptoms. So every question that you ask, we give the best answers we can.
Sure. This thing is evolving and changing on a daily basis. I think most people understand that.
Can you get it twice?
And to get back to the previous question, so how contagious is this relative to the flu? I think one of the problems that we're struggling with right now is that most of the data is coming out of relatively densely populated urban areas.
Right.
It may be that in the U.S. in general, where we have population densities other than a few areas that are not quite as dense, that the transmission may not be as great. So I'm a little hesitant to say anything specific.
Sure.
Because the different expert groups have been giving different estimates, but I think we can say that this virus is more transmissible than an average flu, but to what degree, it's difficult to say with precision.
So is this like a normal virus that if you get it, you have the antibodies to fight it, so the chances of you getting it again are minimal, or can you get COVID-19 again once you've recovered from having it for the first time?
So the best evidence at this point is that for people who have reasonably normally functioning immune systems, that once they get the virus and they clear it, that they will continue to produce antibodies that will prevent them from getting reinfected. The one thing that we can't certainly answer at this point is how long will those antibodies sustain? Will they be protected for a year, for 2 years, for 10 years? That we don't know, but it would be extremely unlikely that for a typical reasonably healthy person, that once they get the virus, that they would get a second round of infection.
Good.
Now, since you are a health officer there over in Calvert County, okay, so young people must be driving you crazy because they're out and about and it's spring break and they're out of school and stuff like that. But I had a question from a listener. What are the chances of testing everybody? Because as you've said, some people have very mild symptoms. Some people don't even. They're asymptomatic. They don't have any symptoms. Is that there's no way we can test everybody?
Well, at the moment, that's just a completely hypothetical question. Our goal right now is to get, number one, enough testing kits, and then number two, lab capacity at the point where anyone who's symptomatic can get tested. In an ideal world, it would be wonderful to have unlimited testing capacity for lots of things.
Right.
So I would say that that might be a better question in a week or two.
Okay.
Once we see that we can start to, again, have very accessible testing for people who their doctor or nurse practitioner feels at this point it's important for them to get tested.
Okay, I got another question from a listener who emailed it this morning. She works in retail. She works in a big box store. They are remaining open to supply people with what they need. She says she's doing everything she can to stay healthy, but is there anything else that she can do to help her, I don't know, boost her immune system or stay healthy so she doesn't take anything home to her family? She says her employer, they're kind of, they don't want them to wear masks because they don't want to panic the customers. But for people that are still working in grocery stores and gas stations and banks, is there anything that they can do to help, I don't know, stem it or at least give them a boost?
And so first off, I'd like to recognize all the people who are keeping vital supplies open.
Yes.
We acknowledge first responders, as we should, frequently, but people who are working at grocery stores, working in lots of places, daycares, other places that are really vital right now, those people are really stepping up.
Yes.
And I think the reassuring answer is that actually they're not at extremely high risk from the contact that they're having from customers. The main concern would be the common touch surfaces to be cleaned, but for the most part, customers are passing by them. Where we really get most worried is that when people are spending greater lengths of time, especially in very close proximity. So the rationale behind closing restaurants and closing movie theaters is that you're sitting within a foot, a few feet of somebody, and for lengthy periods of time, for a half hour, a couple hours. That's really where the concerns are for transmission. And so wearing a mask in that setting, honestly, is not going to really make any difference. It's making sure that the cash registers, any place that customers in particular are touching frequently, that they're going around several times a day with appropriate antiseptic and cleaning off. In terms of boosting immune system, there have just been claims for decades about this vitamin supplement.
Right.
And they've never shown to truly be effective. What is effective are those vitamins that we get in our food. There's very likely a difference in the way we absorb those nutrients when we eat our meals, things that help us to better absorb and utilize than when we just get that vitamin in a separate pill form.
So yeah, pot pies and Twinkies, not a good way to boost the immune system.
Maybe it occasionally supplement. Certainly not a mainstay. And so these are all the basics that we all know, but sometimes, especially when we get stressed, we sort of forget that we really need to get our sleep and taking time to make sure that we're eating properly. Those sorts of things are really important.
Doctor, what about stress? I mean, seriously, people are stressed out of their minds. Would you suggest going outside? I mean, especially on 2 beautiful days that we have coming up. I mean, is fresh air a good thing, or do we not want to do that?
Yeah, that's a great suggestion. And one of the wonderful things about living in Southern Maryland is none of us are very far from really getting back to nature. For some of us, it's just literally in our backyards, just going and walking around the area that we live in. For other people, they might hop in the car and drive 5 or 10 minutes, and then have whether it's a county park or just one of our beaches to go out. And the other is, and we've been doing this here at the health department because we certainly have been keeping our doors open. We provide vital services for the public. That we've been leaning on each other, not physically leaning on each other, but emotionally leaning on each other. That we're dealing with all sorts of calls from people, just like you have, from your listeners,
right?
And constantly with these changes at state level and having to shift unpredictably, and so having your family members, your coworkers, people who understand what you're going through on a personal level. And you can, and they're there for you, and hopefully you are there for them as well.
Okay, now this is the last question I have for you because I know how busy you are, and I had emailed you this because I had not heard about this until earlier in the week. Are there medications out there that scientists are discovering that are actually helping, like this remdesivir, I think is the name of the T had talked about it earlier in the week, and you hear all these stories coming about, about people trying. Oh, did we lose him?
No.
Oh, good. There you are. Are there medications that show promise? I'm not saying are the be-all and end-all, but show promise?
So the ideal would be to have a vaccine, but as I'm sure all your listeners have heard, likely a vaccine is going to be a year and a half away.
Right.
And so what they're looking at are medications that already are on the market or have been through significant trials to see if they will work for this virus. So the remdesivir, which is the medication that you're asking about, that to this point has not shown to be wonderfully effective in the previous clinical trials that they've done, but those trials have been very limited. Mm-hmm. So one thing that they tried it for was Ebola. Didn't work as well, but this is a different family of virus. They have experimented with this medication with the virus that caused SARS and MERS, which are also coronaviruses, but those waves of infection burn themselves out very quickly. So they never did human studies. They did animal studies and in cell cultures. And that medication did show some promise, but experimenting in lab animals and then how that's actually going to work in human beings is an unknown. So there is a clinical trial. Actually, there are 2 clinical trials in China right now, and there is a trial underway in the U.S. where they're trying to match protocols with what's in China to increase the numbers so they'll more quickly have an understanding of its effectiveness. The reason they don't just give it to everybody and they do it in a trial is that until you know it works, you want to make sure that. Well, let me backtrack a little bit. If you just give it to everyone, you have no idea whether the medication worked or not.
Right.
And so questions are, even if the medication works, and that's very much an if at this point. At what phase during the infection is it going to work best? And that's something you would not know unless you do specific trials. Who will it work the best? So does it work in older people as well as it potentially works in younger people? Mm-hmm. And then what are the side effects going to be? So we know that for medications like this, they can potentially cause liver damage. And so you certainly wouldn't want to give a medication to people if it's not adequately effective. And these are people who are sick and their livers are already stressed. You don't want to compound problems unless you know that medication really works well.
Right.
So this medication, good old-fashioned chloroquine, which has been used for a long time for malaria, there's some evidence that it might have some promise. So there are multiple trials with multiple medications going on right now, but at this moment, there's not enough evidence for any of them to say that this is truly effective, not to mention how it would best be used by doctors to treat patients who are sick.
Okay.
Listen, Dr. Polsky, thanks so much for joining us again, and I'm sure we'll touch base
maybe
again.
Next week. Maybe we'll make this a weekly date. How about that?
That would be fine. I'm hoping we won't have to do this.
Yeah, wouldn't that be nice?
I know.
But
me
yeah,
too.
as long as it's going on, I'm more than happy to take the time.
Thank you, sir. All right,
Thank
thanks.
you so
Thank you,
much.
sir. Have a good day. 8:27. That, again, was Dr. Larry Polsky, who was the health officer for Calvert County Health Department. And, listen, it has been said, but it should be said loud and proud. Thank you to all these healthcare workers who are out on the front lines and dealing with all of us sick people.
Yes.
And exposing themselves to all sorts of dangers and whatnot.
And the first responders, the ambulance crews,
right.
And everybody who is doing just a great job. We appreciate it.
You're all doing a good job. We're going to get through this. It's going to be okay. The economy's going to come back. The sun will definitely shine.
It's going to shine. It's shining right now.
It's shining right now. We've dealt with tougher. You don't remember it, and maybe you weren't alive for it. But we have. We will. It's going to be okay.